My name is Jane. I'm a BCBA at Siskin Children's Institute. You may be asking yourself, what is ABA? How could ABA be used to help my child? And what do I need to do to get started with ABA? ABA is a therapy based on the principles of learning and behavior. We try to understand how behavior works, why behaviors are occurring, so that we can identify replacement behaviors and things to teach a child to do instead. We focus on socially significant behaviors and behaviors that will help a child be more independent. A skill that we very often work on with our clients is functional communication. So we may be addressing communication throughout the day, the child's normal routines, in the natural environment, during preferred activities, and figuring out ways to increase their communication. ABA has been widely researched since the 1960s, and it's been recommended by the American Academy of Pediatrics as an evidence-based and effective treatment for children with autism. ABA focuses on increasing functional skills that will help increase a child's independence, their social skills, their ability to participate in school and in community settings. Parents may be wondering what to expect once they receive a referral for ABA services. They'll be brought in, they will come to the clinic to do an assessment where the BCBA will talk to the parent about their concerns, about the behaviors that the child is engaging in, about the child's skill level, and will assess the child's current skills. We look at their ability to communicate, their social skills, any behaviors that they have which may prevent them from participating in school or in community activities. The program here at Siskin is primarily home-based. However, we can go into schools or in really anywhere in the child's natural environment. We also offer services in the clinic here. However, primarily we're in the home, as that's where most of the learning for the child can take place. I think when choosing an ABA program, parents should decide whether or not it's a good fit for home-based services, or whether they would prefer for sessions to take place in a clinic, and the number of hours that they feel comfortable with receiving based on the BCBA's clinical recommendation. Early intensive behavioral intervention, typically the number of hours may be higher, maybe 20 to 30 hours a week. This is based on research showing that that number of hours leads to the most effective outcomes. But it really depends on the child's skill level, the behaviors, and the behavioral concerns, and what's going to work best for the family. ABA can absolutely be effective with children at any age. It's not limited to young children. The therapy just may look different depending on the age of the child and the goals that we're working on. You know, we really gear the program around each child's needs and the family's concerns and their goals for therapy. We want to work with the families in the way that's going to work best for them and be most beneficial for the child. If you'd like to learn more about ABA at Siskin Children's Institute, visit siskin.org/ABA or talk to your physician to learn more.